So you guys, as fellowship and other EMS directors, you guys have far more, I think, experience in the EMS side of all of this. My hope is to kind of show you what we do. Our school has and we actually just are shifting it, but we've had a interprofessional elective that we've had to do experience for the past number of years. And a few years ago, we invited the students. We created the EMS version of that. And we're actually taking it a step further and expanding it. That's been a 2-week experience that we've done. Moving forward, we've created a health system science elective, and as part of that, we're kind of placing interprofessional education inside of that because it's about how you work with teams and navigate a system. And so this is actually being kind of rolled up into something else that we're developing too. It's been pretty successful. So we'll just get started. Obviously, it's a small intimate group. It's kind of a niche talk, but if you guys have questions along the way, happy to share things. So couple of goals and objectives. I just want to talk about the benefits and the challenges, things that we've kind of solved in the past couple of years doing this, and give you guys the opportunity to kind of design and implement this at your shop. So some of the background for this is that medical, the LCME says medical schools have to teach interprofessional education, and that's really one of the reasons. And I don't need to tell you guys the other reasons that we invite students to do this. Is it's really fun, it's really cool. It's exciting for them, so there's like some glam factor there. But then the other part is, and you guys really know this, that when you take students and introduce them to EMS, it's not about just introducing them to the EMS systems, but for the students, and sometimes our residents too, it's about actually taking them and putting them at the place where the patients are, so they understand the patients that are coming into the ED, what their life circumstance, right? And that's a whole recognition of healthcare disparities and things like that we struggle with teaching. So that's like an added layer of doing this specifically in EMS, because it gets the students out of the hospital into an environment where the patients really live. So there's a little bit of data that we have on this, but not a ton. There's just a couple of studies, and there's really no studies that examine EMS or really EM that in that much detail. But with regard to interprofessional education, there was one study in 2016, 16 medical schools. Now, the reason that they've studied this, and the reason that AAMC has adopted interprofessional education as a really important part of medical school curricula is because there are some proven outcomes to say if we work as a team, we lower blood pressures more, we lower LDL cholesterols, things like that, better A1C control. And those are actually associated with decreased mortality in population. So we know that this is an important part of taking care of patients. So what these authors did as part of the Interprofessional Education Collaborative, they created 4 core components or core competencies for the IPE experience. So values and ethics of interprofessional practice, roles and responsibilities, interprofessional communication, and teams and teamwork. So that's like the core of what they decided broadly is really applicable, and all that stuff fits really, really well in with EMS. So here's what medical schools have done over time. You can see back in the 2009, just above 75 medical schools across the country were doing it. Now it's nearly double. They didn't get data in 2016 for some reason. It was kind of interesting to me that a lot of schools implement this in the pre-clerkship years. Now, there's obviously some overlap there. Maybe not all schools are doing that. And then some of them do it, and still at a pretty high rate, 81% in the clerkship years. I'm not sure what the other is. It's kind of it's either preclinical or clinical, I guess. But it's pretty highly implemented across the country. And I picked 2018-19 because that was the last set of data that was available from the AAMC. The goals that they have here align really well with those core competencies. If you're looking for additional resources or just the webpage here, that's what the QR code is for, is kind of take it as to see what people are doing across the country. But students familiarize medical students with the roles of other health professionals, function on a team. Those overlap with those the goals from the collaborative pretty well. Not so many people are trying to teach specific content areas, and fewer people are still trying to teach a clinical skill. We're not really trying to, and this is like the interesting part for me, is it's a really unique rotation, and it deserves some unique attention, because we're not actually trying to just have them take care of a patient like so much of what medical school is, right? So we're actually recognizing at the level of student education that we don't need you to just simply be in front of a patient, take another history. Like, that's a skill set you develop pretty well. but how do you interact with the system? How do you work with a team? So it's giving intentional focus to that. This is about the sum of literature about anything related to this. So in EM, this is for those of us that maybe had read Annals in 1980, 3 years before I was born, that was what there was. No, it hasn't been really updated. There's a little bit of information from a Scandinavian journal about medical students doing this with EMS. And really this is more of a residency focus on curious. So it's also an area that could be really ripe for some study if you want to like track the experience of the students. One of the challenges with tracking the experience in publishing is that, again, most of our medical school assessment for students has to do with the clinical skills that are built on everything from the MCAT to other assessment tools that schools have. So we need to kind of find a better way to assess what we're trying to measure or trying to teach, right? Or measure what we're trying to teach. So can those students work with a team effectively? How do we measure that? So that's also a whole other area that's kind of ripe for study to kind of define this. So we're in kind of uncharted territory. It's a little bit experimental. So just a couple of words about us so that I can tell you what we've done and how we've developed this. This is our footprint in Pennsylvania. The darker blue color there is kind of our primary service area. The lighter blue is kind of a secondary service area, and then we have an integrated health system with a medical insurance health plan, and that's generally the area that we cover with outlined in yellow there. So about 3 million patients in our secondary coverage area, and so because of that, we have a bunch of helicopters. We've got six bases and 9 different helicopters. Actually, one of them's licensed with another hospital system to our southeast. When we have the students do this experience, this is kind of that flashy draw, right? This kind of primes the students to come and experience this. So we put them on the helicopters for about 3 days over the course of 2 weeks. We find that that's enough because we actually have a bunch of other observers and trainees and of course all the other stuff that you have to do with their medicine, and 3 days is enough. Sometimes they get a day without a flight, that's okay. When bad weather happens, sometimes we can reschedule at the last minute and flip it around. But as you guys know, the flight teams that work on the helicopters are extremely experienced, have a lot of great perspective, and they're great teachers even when you're sitting in the hangar waiting for something to happen. So there's still lots of learning, and the element of teamwork really gets emphasized no matter whether you go on a flight or not. We have a critical care ground crew because of the rural nature of where we're at. We do a lot of interfacility transports and things like that, bringing them to our tertiary care center. We have the students spend about 2 days on the ground crew team. It is more kind of transport oriented, so it's not as, still a lot of teamwork. Students are, this is an experience in their 4th year, so they're much more adept at kind of having that critical care perspective or being willing to learn and not being overwhelmed by what's going on with the patient. But we have them do 2 days on this.
Are you allowing them to participate in patient care as if they would in the ED?
Yeah, they totally can, right? It's just kind of like de-emphasized from the rotation, right? So it's an opportunity in front of you, and you're going to be in the back of an ambulance for an hour or 2 hours, going from one place to another with we'll take them from Danville, where we're at, 2.5 hours down to Chop and Philly or something. And you're in the back with a nurse and a paramedic. Let's talk about the patient. Let's talk about what we're doing. Let's talk about the vent, the drip that they're on, all that kind of stuff. So that stuff happens too, for sure. When we have special events, so if it overlaps with somebody, we have one of the biggest state fairs in Pennsylvania happens just down the road from us. So this is actually a picture of one of our former medical students, and then one he stayed on for residency with our trailer, of course. And so we invite them to go do that because, again, that's an experience, right? Whether it's both a focus in EM as event medicine and then also within EMS. We have mobile integrated health paramedics, so this is adding like another layer of perspective. This is a part of EMS, but it's also part of like how we approach systems-based care for all of our patients. So our mobile integrated health paramedics, they have to be, of course, in Pennsylvania in particular, supervised with medical command from EM-only physicians, but they also have a delegated practice through our cardiology team, and they also work with our home health organization. So we have a medical director for that who knows to reach out to, we have a system triage officer model where in our transfer center it's only EM docs. So we can actually provide medical command from that role as well. So when home health is there or the paramedics are there, the home health is staffed largely by nurses and advanced practitioners. But if we don't have those folks who are able to go, they'll use the mobile integrated health paramedic. We put the students with the mobile health paramedics for about 3 days out of the experience, and then the remaining 2 days of that 2-week experience ends up being just with general EMS, ground EMS. But when they go do this, they're with the mobile health paramedic. Maybe they'll meet there with the AP or the nurse if they need them for some reason. And it can be anything. During COVID, it was doing home swabs on homebound patients, to doing an assessment and deciding over telehealth what that patient needs. And then we've been fortunate to be part of the ET3 kind of experiment with CMS. So our students are actually, some of them have actually heard about ET3, knew that we were doing it, and when they came to do their EMS IPE, they were kind of like, can I get to see this thing in action? So for anybody who might not be familiar with it, right, EMS doesn't get reimbursed if you don't take a patient to a hospital. It's the fundamental nature of it. And so ET3 is hoping to break that model to say we can actually treat them in place. So our students are seeing kind of what cutting edge EMS essentially is, or the future of EMS perhaps. And they get to witness that and again watch the collaborative nature of it's, yes, the patient's being assessed and treated in front of me, but also this is like how the stuff actually gets done, with an emphasis on that part so they understand the system a little bit better. So certainly the benefits that we've seen from just that is the interprofessional exposure. They understand better what a paramedic is and what they do. If they've never had any exposure to EMS before, they understand differences in EMTBs and paramedics, and we've got an advanced EMS EMT designation in Pennsylvania. They understand the difference with like a critical care paramedic versus a critical care nurse who works on the truck. So they get that. They understand the healthcare resources needs, as I mentioned. They're getting into the community and going to see the patients in their home. So they understand something about healthcare disparities and where our patients are coming from. It's very reflective. I mentioned before that we don't have a great assessment tool, and it kind of leads me into one of the challenges here. It's the third bullet down. But instead of using our school's assessment tool, because this is an experience that all students are required to do, we actually created its own assessment. And it's a narrative assessment. So they do a reflection on this. They talk about the teamwork. They talk about, or they write about how they saw the team work together and the challenges they overcame in caring for the patients. So it's been really nice. We sometimes even have them this past year, and wasn't part of this, but it will be moving forward. In a different elective, we actually do like a think, pair, share kind of thing. So you do your reflection, and then you get together with somebody else who's in your class and talk about your shared experiences and what you kind of learned. Communication's a bit of a challenge. It depends on your system, right? So in order for me to make this happen, I have to tell our Lifelike coordinator like 3 months ahead of time that I'm going to send you some students, and then somehow when it gets like a month out, she sends me the dates that'll work for that, and I have to backfill the ground truck. The mobile health paramedics generally don't have people with them, and EMS can, through the size of our organization, we can afford to kind of find a space. So it all works out, but it is a little bit of like extra work to do some scheduling. The solution there would be either a standing schedule that just everybody kind of agrees on, or some sort of a template or something like that. Being with the student, communication becomes like really, really critical. All of our students, like we either have their phone number for just a text message or something, or a phone call. We also have Tiger Connect as like our secure messaging app, so all of our students have access to that. So it helps. But the challenge here is that the students aren't, it's not like the traditional rotation where they're like just in front of you and showing up to the same ED every day. So being out there, making sure that you have an ability to closely connect with them is a unique aspect of this kind of rotation. So it's a great opportunity. I think we get really great feedback on it. There's different versions of this that you can do. So I think for many of you in the room with a background, you maybe be interested in kind of setting up a whole separate rotation as an elective or a selective or something like that. But this is something that can be scalable. You can totally just do this on a shift in an EM clerkship, right? It can just be part of a kind of a nested model, if you will, or it can stand alone. And you can use any of the resources that we mentioned here to build this, but you of course can use things that are unique to you. So do you have mobile health paramedics? Maybe that's something that's more closely integrated with your healthcare system and something that you could do. Maybe it's just standard EMS and ground EMS, but there's still a lot to learn from that. You can also give students the exposure to EMS administration, so folks who are leaders, right? So you've got a statewide conference call or something on one of these days, invite the student into that experience to understand how some of these decisions are getting made, and expose them to the other aspects of interprofessional education.